I'm Amy Patton, and I am the registered dietitian and nutritionist at the Nevada Cancer Institute. And I have been working here for 4 years since we opened in September of 2005.
Hi, my name is Monica Yu. I'm a clinical dietitian at Summerlin Hospital. I work for Sodexo Healthcare. I've been a dietitian for about a year now.
My name is Colleen Corey. I'm a registered dietitian and I'm a certified diabetes educator. I work here at Southwest Medical Associates, which is part of United Health Group, as a diabetes educator. And so I work in the endocrinology department of our clinic here.
Hi, my name is Alyssa. I'm a registered dietitian with Children's Heart Center, and I work in a pediatric cardiology office treating overweight children and their families. I've been a dietitian for 10 years, all 10 here in Las Vegas, and I started out in clinical, working in the hospitals. I knew it wasn't what I wanted to do long term, but I knew I needed to get a stronger base in that background, and then I've been working in pediatrics, specifically overweight pediatrics, for the last 9 years.
Hi, my name is Sharon Nasser, and I work as a registered dietitian at St. Rose Hospital. I've been a dietitian now for 6 years.
I decided to become a dietitian after I took a basic nutrition class in college, and it really interested me how food and nutrition could be used to treat illnesses such as diabetes and whatnot, and how it was so much based on how you ate, and I thought that was really interesting.
I decided to become a dietitian because I thought it was important that people could maintain their health or prevent disease through nutrition, through most natural way, through food.
In the endocrinology department, we see high-risk patients with diabetes, whether it's type 1 on an insulin pump, whether it is uncontrolled diabetes type 2, or the whole 9 yards. And generally, it's if they have an A1C that's too high, they come here to the endocrinology department. So my schedule generally has anywhere from 12 to 15 patients a day, or actually I should say more than that. And anything from somebody that just needs a simple nutrition encounter that, you know, just needs to cut down on their carbs and exercise a little bit more, to doing insulin adjustments. My last patient today was somebody that's on a pump and didn't really know that much about the insulin pump, so I had to do a lot of education with that. And I spend most of my day doing nutrition counseling and exercise with every single patient, and then a lot of medication adjustment.
I am a writer, speaker, spokesperson on health and food. So I work for a number of different clients, mostly food manufacturers and commodity groups, and I write website content for them. I do speaking engagements, and then I do some spokesperson work behind or in front of the camera, not only on specific products, but on nutrition topics in general.
I work as a clinical dietitian, so basically I mainly see inpatients and who may need nutrition counseling regarding their diets. Specifically, could be cardiac, renal, low fiber, high fiber, diabetic. We also over here will teach people who are newly diagnosed diabetics to test their blood sugars. We calculate IV nutrition and tube feeding formulas. I teach cardiac nutrition classes to the community, train interns, and I also facilitate an eating disorders support group the first Saturday of the month at St. Rose Siena.
Other than talking about food all day, I just like the interaction with people. I like meeting different people every day, and one of my favorite things about working in an outpatient setting is that you really get to know your patients and follow them through treatment. So you get to really establish some nice longer-term relationships with people.
I would say my favorite part about being a dietitian is the interaction that I get with families, kids, with people. I fortunately get to sit down with them, get to know them over a period of time. For me, that's rewarding, more so rewarding than the clinical setting where I would see people and then they would leave the hospital and not get any follow-up.
My favorite part of being a dietitian is meeting all different types of people and potentially making a change in their eating behaviors and how they feel about food.
One of the most important things, I think you just have to have great, personality, because you do have to form a good rapport with your clients and your patients very early on. As soon as you meet them, if you're not warm and engaging, you're going to lose that client or patient. So it doesn't matter how good your menu plan is and how pretty your educational materials are. If you can't connect with who you're speaking to, with your audience, they're not going to hear your message. So I think that's probably the most important thing. And then just flexibility. Dietitians work in a lot of different areas, and so if you can't be flexible, it's going to be difficult to move through our ever-changing healthcare system.
Important skills for a dietitian is communication and listening skills, because even though you're educating patient on different diet, sometimes you become a kind of a counselor, and they talk and tell you all about their lives and things that are preventing them from doing what they're supposed to do as far as diets and nutrition. So it's very important to have good listening skills and good communication skills.
I think one of the most important skills for somebody that wants to be a dietitian is to be able to think outside the box. I cannot believe how many dietitians I met early on in my career that they did not think outside the box. They just went in and did their daily grind, and every patient was the same and every chart note was the same. And I think you just have to be able to think of how you want to use your knowledge, how you want to use your passion for dietetics, in which setting. There's so many different settings out there that you can go into. My path here is so many twists and turns along the way, and I've enjoyed every one of them.
The best advice I got when I was in school was from my preceptor during my internship, and she said that you don't need to know all of the answers about nutrition, but you need to know where to find them quickly. So while you may not necessarily know if you're doing a presentation and someone asks you a question afterwards, you don't have to know the answer. You're not expected to know everything, but you have to be able to tell that person where to get that answer accurately. And so I think just knowing your resources, knowing where the good information is, and knowing where the misinformation is, so that you can either direct your patient, your coworker, your supervisor, or yourself to that information quickly. So I think that'd probably be just something to learn. While it's great to memorize how many calories are in an apple, you can look that up quickly. I think it's more important to spend your time learning where your resources are in the healthcare facility you're working at, on the internet, at the library, because that's where your consumers are going to be going a lot of the times, is the internet or magazines.
Get out there and see all the fun things that you can do with this profession. Everybody's interested in food, and it's something that everybody on this planet does every day. So you have a lot of opportunities to get involved and help people and provide really good advice, good sound science-based advice. So if you can just get out there and see what's available, I think you'll find that this is a fantastic profession to